how diabetes affects your eyes. It cannot be overstated. Regular eye exams can help detect diabetic complications early, thereby preventing serious vision problems in the future. And this is an excerpt from the American Diabetes Association. Good afternoon, Lagos. And I must say, welcome. So great to have you on the show. Of course, you know this show, week in, week out, we're dedicated to tirelessly raising awareness on all matters related to your eye care. Now, you know, it's the last Thursday of November, and this month, I will say this month has been particularly special. A month focused on raising awareness about diabetes and its impact on eye health. In November, we observed World Diabetes Day. That was on the 14th of November, and of course, as a family here, Eyes on the Road family, we did our best to offer informative, and we had like a very well-rounded discussion on the topic, and we had plenty of takeaways for our listeners. So as we close out the month, today's final segment is extra special as we'll be addressing all your questions and concerns on the topic. So please do me one favor, stay with us because we've got a lot in store for you. Welcome to the show, and today, of course, our optometrists are here up until 5 o'clock, and our goal is to enhance your commute with valuable insights to help you make informed decisions about your healthcare. One more time, welcome to Eyes on the Road, and the show is proudly brought to you by Lagos Traffic Radio 96.1 FM, and of course, you know my name is Akan Usen. Alright, so like I gave you prior information I gave you about diabetes and all that and its effect on the eyes. Today's show will address previously submitted questions with professional answers from our optometrists in the house, and of course we invite you to join the conversation. Feel free to call in with any of your questions, your concerns about your eye health, and you can also just share on today's topic. First, optometrist Dr. Priscilia Imade, Doctor of Optometry with a PhD in Public Health, a consultant optometrist at Modern Eye Care Foundation, and a newly minted fellow of both, of the American Academy of Optometry, and also a fellow of the Nigerian Optometrists Association. Next to her is Dr. Rashidat Aruna, Chief Optometrist at Modern Eye Care Foundation, situated in Omoli, Ujudibaja, Lagos. So, welcome, doctors.
Thank you. Thank you very much, Akan.
I could see, Dr. Aruna smiling, grinning from ear to ear, like,
Yes, no, it's not easy to be an American fellow.
You know. And Doctor watched it too. She watched it for us.
Thank you. Dr. Aruna, you're next.
All right, you're welcome. So welcome, doctors. Over to you. Of course, let's just remind listeners that the number to call is 091-538-77127. We've been getting a lot of feedback that the first line doesn't seem to go through as easily. So it would be nice to hear from you. You can just call 091-538-77127 while we try to fix the 777 line. This other one will go really easily. We'd love to hear from you, dear listener. It's open day and it's all about you. All right, back to our doctors.
Yes, November has been a very interesting month, and our focus has been on diabetes. We've explored how diabetes can affect the eye, and it has been very interesting. Even back in our clinic, we've seen some very interesting cases. In fact, there was a patient that came in, and he didn't even know he had diabetes.
Okay.
And from the look of things, the diabetes has been there for like maybe for 5 to 10 years, because by the time we examined his eyes, he already has serious damages on the posterior part of the eye. So diabetes is very crucial. If you must have good eyesight, you must screen for diabetes. Not even say there is no diabetes in our family, because by virtue of the type of food we are eating now, and the kind of lifestyle we are living, it predisposes virtually everybody to diabetes, because most time is sedentary.
I must butt in with this. Of course, today is National Family Health History Day.
Fantastic.
And I was alluding to the fact that you're always talking about family history,
Yes.
health-wise.
Yes, thank you, Akan, for that reminder. You know, almost everything has a day for me.
Yes.
So it's good to know your family health history. And also, another risk I also find out that people who have diabetes, they face in this part of the world is that many people, when they are even diagnosed of the diabetes, they don't go to see their physician or, you know, see their specialist as far as that is concerned.
What could be the reason?
Well, we all have different reasons because traditionally we always want to explore the traditional way or home remedies,
Or
self-remedy.
the cheap route.
Sometimes it's not even about being cheap. Some people just believe that they should do some home remedies first before buying orthodox. Some people still shy away from orthodox treatment. In fact, there was a case my doctor and I were just discussing before we came online about a patient who, you know, he had diabetes. Then he went to these herbal people to go and buy diabetes. And when diabetes herbal drugs, and when he came to the clinic, we told him, okay, bring the drug you'll be using, the medicine you'll be using, and he brought it. When we look at the content of the drug, there is sugar inside, you know, what they gave him, and he's diabetic and he's taking it. Also, there also another case too that we found out that the drug is about alcohol. They use alcohol, you know, this local gin to prepare the drink or the medicine for the diabetic patient, and then they tell them that it's going to clear everything. That's not the way to go around. At the end of the day, they just discovered that their vision, you know, would have been damaged. Over to you, Dr. Aruna.
Okay. So we have some questions. Today is open day, just like we introduced at the beginning. So you can always call in. Let's answer your questions and whatever it is you have in your mind with regards to diabetic retinopathy or any eye condition that you feel you need clarification on. So in the course of the week, we had some questions and we'll be taking it along. Good afternoon, doctor. I've been diabetic for 3 years, but I manage it properly. Do I still need to check my eyes? So this Bode from Ikorodu. So I must commend you if you are managing your diabetic properly. That's a good one. Yes.
When managing, what do you mean? Taking the drugs, watching what you eat?
Yes, that's a good question. Yes, it involves taking your medication and not taking it the way you like, taking it the way the doctor prescribes. So because I've seen a lot of patients, they'll tell you, I'll take it today.
I know someone. Today, the guy said he will take one.
In fact, we had a patient this morning. The man, when he came, his blood pressure was very high, and he said he only takes it when he feels the symptom and sign. That's why some people they come down with stroke. You know, and then they will not say it's one witch and one wizard.
It's already critical for you to be feeling headache. It's already critical.
This one, we checked his BP and the BP was high and he didn't know. He said he has not taken it for 2 days, maybe 3 days, something like that. And he only takes it when he feels like it. Over to you, Dr.
Yeah, so you should take your drugs as prescribed by the doctor. Then if you are also under diet watch, that's nutrition, you should follow strictly. Then if your doctor has told you avoid taking alcohol, avoid doing this, some people, when you say stop taking alcohol, it's as if you are against them taking alcohol. No one is against you taking alcohol. We are just all about your health. So all the things you need to avoid them. All the things you need to do them, and then go for medicals as prescribed or as recommended by your doctor. So if you are managing your diabetes properly, kudos to you. And then alongside managing your diabetes, you should do comprehensive eye examination or dilated eye examination. Dilated eye examination, very important, because once your eyes are dilated, we're able to look at the posterior part of your eyes, because that's where the damage goes on, you know. So, and also depends on the number of years you've been managing diabetes. Okay, you might be managing your diabetes very well, but duration also matters, because
when you say duration matters,
yes, how long the diabetes take will determine the damage that will happen in the eye, whether you are managing it properly or not. So that's why you must be doing tests. As you are managing your diabetes, be doing corresponding eye examination. Duration is one of the highest risk factors for the development of a retinopathy as far as diabetes is concerned. Yeah, we have a question here that says, good day, doctor. My mother got blind about 2 months ago, and they told me it was glaucoma. She can only see shadows. How can you help us? Can operation make the vision better? This is Dele from Omole. Thank God you are from Omole. We are just opposite you there. Just bring and let's assess and give you a second opinion. So sorry about your mom that got blind. It's very pathetic. You see, many a time people don't know that they have glaucoma. That's just the painful aspect of it until significant damage have been done. Well, blindness from glaucoma actually is not reversible, but we can still check if there's, maybe something can still be done to just manage whatever is left. Okay?
Whatever sites?
Yes, that is left.
Okay.
Sometimes people that have glaucoma could also have diabetes. Once the diabetes is properly managed, the vision can improve a bit. Okay. Sometimes if there's diabetic cataracts and the cataracts is taken out, or once the amount of sugar from the lens also reduced because the blood sugar have been properly controlled, some form of vision improvement can also be noticed. Okay. So those are the things that we may have to look at.
All right, a quick one. The traffic situation at this time, all the way from parts of the island via the 3rd Mainland Bridge inwards Baja. I can confirm to you that it's looking really, really good all the way through to Baja. And those coming in from the Eko Bridge end, well, of course, you have it busy on the Eko Bridge in the Costain end. But from there, as you connect Alaka, as you connect Funshaw Williams Avenue, all the way through to Domalong Bridge, nothing to worry about at this time. Funshaw Williams Avenue, yes, looking friendly. Further inwards Maryland, that stretch is still looking good all the way through to Odoyalaru and beyond inwards New Garage or Jota Interchange K2, even inwards Demuri. It gets just a little busy around Demuri. And then onwards journey Iyano School down towards mile 12, the Odogun end. At this time, things are still looking really, really good. Nothing to worry about, nothing to see there. But of course, as the day progresses, more influx is expected, return journey influx. But I trust that as things change, we'll definitely bring you up to speed. And we'll also give you feeds on other stretches. It's eyes on the road, and of course, it's open day, and we're touching on diabetes and its effects on the eyes. So please, we expect your calls. 0915387727. We'd love to hear from you. Over to you, doctors.
Okay, there's a question here that says, Doctor, is there any food substance or drug that can make diabetes going to affect the eye? Doctor, how about you? What kind of food?
There is no food substance or drug that will make diabetes affect the eye. Okay, so there are food substances, drugs that can help manage your diabetes. Okay, but diabetes affects the eye eventually because it leads to diabetic retinopathy. So the food substances and the drugs you need to use is to control your diabetes or your sugar level. So whatever it is your doctor is recommending, we have different medications, even injections to manage sugar. Also, we have antioxidants to help keep the retina okay, very good. So that's all you need to do. Then if you are eating, avoid food with high sugar levels and all. Those are all you need to do, to keep your sugar levels okay, to keep your eyes okay. But if you are looking for one drug, okay, that we do magic, I don't think the drug is available yet, so that nobody sells any.
Especially those things they say online. Say, you just buy this.
They're just everywhere.
They are just everywhere.
And
the thing about the internet now, once you check for one thing, you keep seeing everything about that thing, all sorts.
One just have to be careful. Just be careful. Make sure you are seeing your physician. And then you are seeing your optometrist, just follow through. That's just a major thing. Take your medications, control your sugar level. You can actually push the retinopathy far, far, far away if you are really following through with your doctor's recommendations. There's also another question that says, good evening, doctor. Sometimes I get pain in my eyes and it feels heavy when I wake up in the morning. Can that be a sign of diabetes?
What could be the cause of that?
A lot. In fact, there's plenty differential diagnosis.
Okay. But what are the possible things that could be wrong with such?
So sorry, what's the symptom again? Pain.
Pain and heaviness in the eye when you wake up.
Yes, so it could be a sign of maybe a bacterial infection. It could even be bacterial conjunctivitis. It could be dry eyes. You understand? It could be even just
can complicate all those things.
So even that is also a complication of diabetes.
Okay.
So yes, it's also under the list of differentials, and you need to check. Once you check and you are okay, then you knock it off your list and do other tests to find out.
You should just come for checkup. Let's find out what is causing it. Yes.
All right, so just come for a checkup, and you know, the doctors will be able to, you know, do a more informed diagnosis and tell you what exactly is up.
Okay, there's a question here on hypertensive retinopathy. Say, good evening, doctor. Can hypertensive retinopathy lead to blindness, and does it have any sign or symptom? Okay, go ahead, Dr.
Yes, it can lead to blindness. Let me put it that way. Okay, that's for when it gets to the proliferative. So there's a stage called the proliferative.
That's a stage.
Yes, that's a
they
stage.
call it stages.
Yes.
Okay.
So dry and wet.
Okay.
That way.
Those ones will confuse our listeners.
So
Hypertensive retinopathy can lead to blindness. If you are managing hypertension, also be coming for checkup. And hypertension and diabetes, they are like Siamese twins. Most times they go hand in hand. You develop one, over the years you discover that the other one will come up. So, but you just have to make sure you are monitoring. These are systemic diseases that actually complicate the eye. Just come for checkup.
It can cause bleeding. So it causes bleeding on the retina. So once the retina is bleeding, then you are in danger of developing retinal detachment. So retinal detachment is like the eyes, you know, pulling away from the structures are moving away from good supply. Vision is just, in fact, it can happen suddenly that you no longer see. So we've had instances of that happening in the clinic. So you don't want to just wake up and suddenly, in fact, we had a patient that came. He said he woke up, he was seeing. Then after a while, maybe 1 hour, he was no longer seeing again. It just came and was like, hey, doctor, please help me. I cannot see again.
There was one spirit that slapped him or something.
So those are part of it. So you need to be able to monitor your systemic and manage it very well.
Okay, there's a question. It's a good day, doctor. What about children? Can they have diabetes? Do they also have cataracts and glaucoma? That's Mrs. Udo from Ogba.
Yes. Children that have diabetes and they are not properly managed, they can have all that. Considering the fact that we even have congenital diabetes, we have congenital glaucoma. So if the diabetes is that's okay.
We have juvenile glaucoma. And then we have congenital cataracts and congenital.
So that's minus diabetes. Now you have diabetes and you're not managing it properly, or you're not taking care, or you don't even know at all. Because children have diabetes. Imagine children nowadays, they take a lot of sugar, they take a lot of sugary things, and they have a family history. There was
a patient that told me that, doctor, I'll bring my child. The child, the boy is like 9. He said that he's been diagnosed of diabetes and the sugar level is high. There's also that is the child is 13.
Instead of going to get from time to time, I was distraught because I was in a bus and I alighted and saw this man who was half blind. He was having difficulty seeing, and the daughter was leading him, asking for directions, like, please, how do I get into this compound where they're having the fair? And I was like, okay, what do you want? You're like, the father's eyes, that there's a drug they actually buy, and all. I'm not taking away from the fact that we actually have. I'm not taking away from the fact that these drugs are potent, but you know, someone who already is losing the sight.
A lot I can, and I wish the government can find a way to regulate some of these things, because many of these drugs, they make spurious claims.
Fallacious.
How can one medication be curing everything in the eye? It doesn't work that way. And I've seen many patients go blind
Even
because
today.
yes. Even today.
And some of the people that even prescribe all these things, they are professionals, so-called professionals.
Educated people.
And the patient walked in, serious pain, very serious pain. After we finished treating, was like, "Thank you, doctor." The pain was so unbearable. And when she gave me the list of eye drops she was using, herbal, who prescribed it for you? It's the doctor I went to meet in so place.
So many things, a lot of things are happening. We just wish our governments can help regulate some of these things so that people will not be going blind. And people that are listening to this program, please try and make informed decisions.
As regards your site.
Yeah, I have a question here that says, apart from using eye drops, are there no solution for glaucoma? The eye drops are too expensive and very small inside. And the follow-up to that is, okay. Can we look at that? Okay, say good afternoon, doctor. Can diabetes cause someone to have cataract?
Okay, we will take that. We seem to have a call. Let's see if we can quickly take this. Hello. Elder welcome, sir.
Our elder, good evening, sir.
I have to thank you for the job. The good job you are doing.
Thank you very much, sir.
Then, this is my question. Little children, what are they thinking that will cause hypertension to their body? You get what I mean? I think it's elderly somebody who can be thinking somehow.
Okay, sir.
Thank you for your question. Yes, sir.
You're only thinking, that causes all those things.
You shed some light, doctor. Because most people feel high hypertension, high blood pressure is caused by just thinking.
It's not just thinking. There are quite a number of things, but hypertension is not a common sickness for young children. If it is found, it's a one-off case and it's abnormal. So something must be causing it, which of course the doctors would address. And for diabetes too, the same thing. Young children, the ratio is supposed to be low compared to non-insulin dependent diabetes. So the juvenile diabetes or insulin dependent diabetes is for younger people. But all the same, because of genetic factor, there's little, there's little one can do to prevent it. But if you know you have a family history, just try as much as possible to do your screenings so that your children will not have it. And if eventually it is detected, then immediate treatment should be started so that complications can be avoided.
Right.
Yes.
Okay, so can we see how to take ourselves to the homeward stretch, because actually time is of the essence.
Okay, Dr. Aruna, can you take this one? He said, doctor, what can carry someone out to know if diabetes has affected the eye and it can be managed?
What else one can carry out?
What kind of?
Well, first and foremost, you check your sugar levels.
Sugar level?
Yes, check your sugar levels. So once you check your sugar levels, nowadays we have diabetic, we have pre-diabetic, we have... If you are pre-diabetic, it doesn't mean there's no diabetic. It just means that the levels are on the border. You should watch it. Watching it doesn't mean ignoring it.
Okay.
Or maybe...
So does that mean like your diet? Or...
Yes. Watch your diet. Do the test again after some time to be sure that it's not going high, because pre-diabetic just means you are just one step away from getting diabetes.
Yeah.
So don't ignore it. And then alongside, do comprehensive dilated eye examination. During your comprehensive dilated eye examination, the doctor will check your fundus, your macula.
We do diabetic eye screening.
Yes.
So just come, we'll do diabetic eye screening for you. Just to be sure that you don't have diabetes or yes.
We also check your pressure to be sure you don't have high pressure that can cause glaucoma. So do a lot of tests. All you need to do is do eye examination.
Yes, eye test is not about glasses. I always say that on this program. when you come to modern eye clinic, for example, we assess your overall eye health and we are able to tell you in detail, things about your eye, even diseases or eye problems that can creep into your eye or lead to blindness in the next 2, 5 years, 10 years. You can detect it early and advise
And
you
nip it in the bud
on what to do.
in time. All right. It's been a great time on the show, and I must say I learned so much. Also, do try to get yourself a copy of Dr. Priscilia Imade's book, Eye Care the Right Way. And yes, right here on the show, we understand how important eye health is for maintaining a good quality of life. We're committed to helping prevent vision loss, and that's why we bring this show every week. We value your feedback on discussions covered on the show. It helps us serve you better. Please continue to share your thoughts. Feel free to go back to our Facebook page, our YouTube channel, and watch past episodes, even today's episode. Our Facebook page is Lagos Traffic Radio 96.1 FM. Our YouTube channel is Traffic Radio 961. Search for the keywords Eyes on the Road. And also remember, share, share, share. Dr. Priscilia Imade, Doctor of Optometry with a PhD in Public Health, a consultant optometrist at the Modern Eye Care Foundation, and a fellow of both the American Academy of Optometry and the Nigerian Optometrists Association. You can reach her on 08033336672. That is 08033336672. The address of Modern Eye Care Foundation is plot 16 to 18 Ogunusi Road, opposite Omole Estate, Phase 1 by Akiode Bus Stop, Ojodu Baja. On behalf of the production team led by Micah Arocha, assisted by Olame Benita, and also interns in the studio, what's her name? Wally, Joanne, and what? Grace, yes, we want to say a big thank you. Also, not forgetting our executive producer, Taya Kunle. My name is Akan Usaid. Wishing you safe travels to your destinations. Bye for now.